Well, so many questions about Omicron and not too many answers. We'll try and furnish you with some right now, because all day here on Sky News, we've been receiving your questions on the booster rollout and the Omicron variant itself. We've assembled now a panel of experts to try to answer some of those questions. Joining us now are Dr. Yasso Brown, GP and diversity lead for the Doctors Association. Also, Mark Jeet, Professor of Vaccine Epidemiology at the London School of Hygiene and Tropical Medicine and a member of the SAGE Subcommittee on Modelling, and Dr. Mukesh Kapila, Professor of Global Health and Humanitarian Affairs at the University of Manchester and a former director with the World Health Organization. Very good to have you all here. So much to get through, and as you know, I'm sure so many questions about Omicron and boosters. So let's get to it. Our first question is coming from Eddie, and I'm going to put this to all of you because there are many parts to it, I suppose, well, at least two. And Dr. Brown, if I can start with you with Eddie's question, it is this. Omicron is more contagious, but it also seems milder. Why is treatment for cancer and heart disease being put on the back burner while the booster programme is being prioritised? And, of course, UGPs are on the front line of the booster rollout. So Omicron more contagious, but it seems milder. So why then other treatments put on the back burner?
Thank you for your question, Eddie. I'd say a Japanese study has found that it's 4.2 times more contagious than the Delta variant. I know that in South Africa they're coming out and advising that it is milder, but we don't know to what degree it is. And we're finding that even though that there is some degree of evasion, that actually there is still an importance in getting the booster in terms of immune protection. I understand the anxieties about pausing the NHS routine and elective care that's sort of being discussed at the moment and that was on Sky just now. No one wants to see any more further delays, but actually we've also got to deal with this issue of understanding how much Omicron might push us back, and that's why I believe it's being done.
Let's get Professor Jeet's take on that bit of it, the idea that Omicron could be more contagious but milder. Now, a few months ago, we were hoping to reach the position, were we not, where we would get a variant that would be perhaps a little, as Omicron seems at the moment, something that we might be able to live with and would spread immunity without vaccination. Could this be it, or is it definitely not?
Unfortunately, it's too early to say whether this variant is milder. We have had reports from South African hospitals that doctors are seeing patients who are less likely to have the most severe sort of symptoms. But the problem is that a lot of these patients they're seeing are reinfections. These are patients who have had COVID before and are now getting infected again because Omicron is able to evade their immunity. Whereas in previous waves, they had patients who were getting COVID for the very first time. So what we don't know is whether these patients are just having milder disease because they're reinfections. They have a little bit of immunity, which isn't enough to protect them from getting Omicron, but is enough to protect them against the worst effects. It will be, I think, a few weeks before we can actually compare like with like. A patient who doesn't have any immunity, who got, say, Delta versus a patient who didn't have any immunity, who got Omicron, and see whether it really is milder. At the moment, we just have to conclude that we don't know that yet, unfortunately.
Dr. Kapila, one thing is for sure, even as we don't know the effect that Omicron is going to have on hospitalisations, we do know the effect that the resources of the NHS being turned to this emergency booster programme are going to lead to more backlogs with already a pretty dire situation.
Indeed, absolutely. And really, this is all about numbers. Even if Omicron does prove beyond reasonable doubt that it is milder and it's going to take time to do that, but because it's highly contagious, the number of people who will get COVID-19 is going to be measured in millions. If that happens, then even if it is not as fatal as previous variants, the sheer numbers involved in terms of hospitalization are bound to be high. Hence the concern that it is much better to be prudent. There's another factor. I think even if we start boosting everyone today, because the number of people in the UK who haven't yet had even their second vaccine is not that very high. And then, of course, it's going to take time to get to the millions done with the booster jab. There is bound to be a gap between boosted immunity and the burden on healthcare systems.
Here's a question following on from that very interesting point, Dr. Kapila, from Phil. Asks, and it's a logical response to the effect of vaccinations so far, certainly 2 of them, and certainly if they're AstraZeneca, on Omicron. Phil asks, what is the point of vaccine passports if you can still get COVID when fully vaccinated? Your feel on that, Dr. Brown?
Yeah, firstly, a line of this sort of questioning, I feel often is about distrust as well. And I think that in recent news, I think our leadership does need to really build that back. So I am sorry for those that it is causing anxiety and feeling of their liberties and that sort of thing. However, just like we have national passports so that we are able to travel, it's the same sort of line, and it's a way of basically safeguarding safeguarding the protection that we've built in with all the different mitigations, not just vaccinations.
Dr. Kapila, your view on that? If you can still get COVID when you're fully vaccinated, what is the point of a vaccine passport?
Well, this whole exercise is about risk and exposure management. So what that means is that if you've had your 2 jabs and hopefully your 3rd jab as well, the chances of you getting a bad COVID are much reduced. Now, I actually spend a lot of my time in continental Europe, in France, Italy, and so on, and where the COVID pass is in common use, going to restaurants and so on and so forth. And while one can understand some of the concerns around the freedoms and the introduction of ID cards and those kinds of things, quite honestly, this is a very small price to pay. And I think having a certificate which says that you've had your basic immunizations is still some protection and some security when using crowded public places.
Yeah, so there's a very big difference, as you say there, between getting COVID and ending up in the hospital and getting COVID and shaking it off after a few days or a week or so. I've got a very specific question here for you. I'm going to put it to you, Professor Jeet. I think you might be best placed to answer this for us. And it's from Paul in Norwich. And he says, my partner and son contracted COVID around 3 to 4 weeks ago. Does this mean they're going to be protected through natural antibodies against Omicron? I suppose the thought being that Omicron may have been around, a bit longer than before we first formally identified it. So 3 to 4 weeks ago, they both had COVID. Could they have natural antibodies against Omicron?
Well, the first thing I'd say is if they were in the UK and it was 3 to 4 weeks ago, it was probably not Omicron. I mean, there was Omicron around in the world, but the number of cases in the UK was probably very, very low at that time. So they probably got Delta. That means that they do not have very good protection against Omicron. I would say that they're likely to have some protection. So the risk of getting Omicron is less than someone who's never had COVID before at all. But I would say that their risk is not zero. They still have a fair chance of getting it. So I would still, be careful going to Christmas parties, maybe, get tested before you go to a big party just to protect other people there. I mean, they might, and please, I would also recommend them to get the booster if they haven't had it yet. So they have a lower risk probably because the antibodies will give them a bit of protection. But because Omicron is so good at evading the immunity we had from previous strains, they don't have perfect or even very high protection.
Just on that, Professor Jeet, how long do you have to wait after suffering from COVID to get your booster?
Well, I think it'd be best to ask the GP, but I think it's about 3 weeks after that they should get it.
Then, Dr. Brown, it is recommended, isn't it, to wait a while until you get a booster if you have been diagnosed as having suffered from COVID recently?
That might just be to suppress having more of a reaction. I don't actually, it's not in my mind about what the exact time frame of distance is.
I'm sure it's there. I'm sure it's there on the government website. But just to stay with you, Dr. Brown, I wanted to put this next question to you all. With Omicron rising, a question coming from WhatsApp. It's a question on many thousands, many millions of people's lips. How likely is it that we will go into another lockdown? Which, if I can turn that question round, is do you think Plan B and what may follow if it's Plan C, do you think they will work against Omicron, or might we need to go full lockdown? Dr. Brown.
Yeah, I mean, I have thought about this, and I would say that actually we're not a COVID naive society anymore. So we have not just exposure, but we've got learning from what we've seen. So what we want to do is make sure that we are protecting the most vulnerable with the information that we've had, the learning that we've had, but also put into the mitigations that we know work. So hand hygiene, face masks, social distancing, companies to look into ventilation, us to think about ventilation, as well as engaging in the vaccine programme. And so I think we just all need to take that responsibility and apply our knowledge. And actually, we probably won't, in my opinion, I think because of the mitigations that we have and where we are, we're not COVID naive. I don't think I think the lockdown is sort of a really last resort, but obviously we've got people here from SAGE and WHO that would definitely be able to advise on this further.
Well, let's have a word with Dr. Kapila about that. Let me put it another way. Presumably another full lockdown can never really be entirely ruled out.
Well, lockdowns can't be ruled out, but with the current state of knowledge that we have and all the tools at our disposal and the current spread, I do not think a decision on lockdowns today, if taken today, would be justified. And remember also that the experience of the last 2 years shows that all that lockdowns do is postpone or delay the spread of infections. So what happens is when you do lockdowns and people are not exposed to the virus, and if they haven't had their jab, then they will certainly not get the virus. But as soon as they go out into the real world, they'll get it if they've not been vaccinated. So what that means is that lockdowns never have been the answer. And thank God we've moved on a great deal from that particular stage. I would be extremely surprised if a lockdown decision argument is made by SAGE or others as being imminent. And I think if the booster program goes even half as well as it is, as the target indicates, then I would very much doubt there will be a lockdown or should be a lockdown.
OK, Professor Jeet, you give me your thoughts on that briefly, and I'm going to add in, because there's so many good questions here, I want to get as many as I can in here. And this is a very specific question, and I'm very interested in it, in that I'm in this position. If I've had 2 AstraZeneca vaccines, can I get the Pfizer vaccine as my booster? I've actually had that. And how much protection does that mixing and matching offer?
Well, in fact, the boosters that are being given are all Pfizer and Moderna vaccines, and these have been tested in trials now with people who have had either AstraZeneca or Pfizer vaccines, and they've been found to give very good protection to either group of people. So this mixing and matching actually works. It's been found to be safe and give very good protection in trials. So definitely the mix and match, as you put it, does work. On the question of the lockdown, I think it's... Happy for you to continue.
Sorry, I interrupted you. A thought on lockdown, potential of another lockdown.
Yeah, I mean, I can't say, because that's really the government's decision to make, and I don't have special insight into what they might decide. But I would say, well, they have to take many things into consideration. The health impact, which the signs don't look great, because there is going to be a big wave of Omicron, but they also have to take into account the economy, the effect on people's lives and mental health and so forth. I would say we're in a better position than we were a year ago because we have the vaccines. And even though we know that this variant is good at evading vaccines, we know that if people get the booster, then that does boost their protection up to a level that does help to protect them against Omicron. So we are in a better position if people get boosted than we were at the start of the pandemic.
And Dr. Brown, you must be getting asked that a lot, I suppose, about people coming in, given the millions upon millions of people in the UK who've had 2 AstraZeneca jabs. Now, as we hear from Professor Jeet, they're getting Pfizer and Moderna, asking that precise question: am I still as protected if I've had 3 Pfizers or 3 Modernas?
Yeah, so JCVI have basically done studies to show about mixed vaccinations, and they've approved it. And also MHRA have approved Pfizer, AstraZeneca and Moderna as booster vaccines. And so generally we would be reassuring people that mixed vaccinations are fine. If they have medical reasons to have AstraZeneca, then that will be continued.
Got a question. I'm trying to squeeze as many in as I say. Got a question here from Dan. He says he's got COVID right now. Poor you, Dan, and assumes it is the Delta variant. Not sure. He asks if people who recover from Delta can succumb to Omicron immediately afterwards, particularly as he's keen to see people at Christmas, as so many millions are. So he's got Delta. Is he in danger still then from Omicron immediately afterwards? Do we know? I'm guessing we don't, do we, Dr. Kapila?
Well, I think if you had a previous strain, then obviously you've got some immunity. You've got T-cell immunity as well, not just the antibodies. So one would, on first principle, I guess, would say that surely your body is fired up immunologically speaking. But of course, you're vulnerable to Omicron because it's a completely different variant. When you would get your Omicron, having just got your Delta, I'm not sure I have the knowledge to give the answer to that if anyone else does. But yes, you are vulnerable to Omicron, even if you have the Delta virus.
And Professor Jeet, on that, I suppose we go back to whatever the situation is after your natural infection. Do get your vaccination as well. Get your booster as well.
Yes, definitely. In fact, there have been studies looking at antibodies showing that people who have had a previous infection and then got vaccinated have even more protection than people who just had either natural infection or just vaccination.
And Dr. Brown, a quick thought, a specific one, and again, you must see patients in this situation. Antoinette is pregnant, had her first dose 6 weeks ago, and she asked why the government isn't reducing the period between first and second doses, because she obviously wants to protect herself. She's pregnant and had her first dose 6 weeks ago.
Yeah, well, first of all, congratulations on that. And what I would say is it's a really difficult situation. I'm just thinking back to what Chris Whitty has said when we've talked about these vaccine gaps and maybe going against the Pfizer 21-day recommendation. It's a public health management. It's a public health approach, basically, and it's about health equity. It's about looking at how long it will last within our immune system, or help our immune system, rather. And also it's going to be about vaccine supply as well.
Brilliant stuff. Thank you so much. We packed so much in the short time available. Thank you so much. My esteemed panel, Dr. Brown, Professor Jeet, Dr. Kapila. We are eternally grateful. Thank you.